Hello, welcome back to my channel. Please, if you haven't subscribed to my channel, make sure to subscribe to my channel. Thank you so much for doing so. It's much appreciated. Who can get high blood pressure? Anybody can get high blood pressure. High blood pressure, high BP, the silent killer is a common condition. For some adults, there's no identifiable cause. High blood pressure is called a silent killer for a reason. It doesn't make you feel sick. So many people will express shock when they hear that they have high blood pressure, whenever they are diagnosed with high blood pressure. High blood pressure does impact your health. It can damage your body for years before symptoms even appear. It is a major cause of damage to the arteries, your heart failure, heart attack, cardiovascular disease. It causes damage to the brain, limit blood flow to the brain, dementia, lead to stroke, damage to the kidneys, chronic kidney disease, end-stage kidney failure. It causes damage to the eyes. It would cause sexual conditions. High blood pressure can block blood flow to the penis. So many issues that high blood pressure can cause. It impacts a lot of the organs of the body. That is why it's called the silent killer, because you can develop high blood pressure and not even know you have it. And over the years, it's in your body and damaging the different organs. So why is it important? It is very important we understand the impact on our health and how to lower it and prevent it. The good news is that in most cases, you can manage blood pressure and lower your risk for serious health conditions. What are the risk factors? When there isn't an obvious cause of blood pressure, it's referred to as primary or essential blood pressure. It often takes many years to develop. But these types are linked to certain risk factors like our diet and lifestyle, genetics, family history, as you're getting older, lack of physical activity. So the risk can also increase when it's combined with unhealthy lifestyle, behaviors like drinking, smoking, unhealthy diet. All of those can combine and increase the risk of blood pressure. So, but when there is a direct cause of high blood pressure, this type of blood pressure is referred to as the secondary. Conditions like kidney disease resulting to blood pressure, adrenal disorder, triggers by tumors. Sometimes high blood pressure that doesn't even respond to medication. Birth control, like those that contains estrogen, tobacco use, sleep apnea. When you have breathing problems, the lack of oxygen can cause harm to your arteries, and that would affect your blood pressure as well. Drug use, hard drug use like cocaine, obesity is also. We also have other factors that can affect blood pressure, like age. As you're growing older, your blood pressure tends to rise as you grow older. Sex. Nowadays, women are about as likely as men to get blood pressure. Ethnicity. So black people develop blood pressure more often compared to other race. Other race does have blood pressure issues, but black people are more likely to develop compared to other race. So, how often should you get your blood pressure checked? It is recommended starting at 18 years, at least for every 2 years. But between the ages of 18 moving forward, if you are at high risk, looking at those factors like obesity, family history, sedimentary lifestyle, I would recommend get it into your yearly checks. Even these days, I've seen kids during the yearly check, 3 years and older is also recommended, and their blood pressure are checked as well. What is the takeaway here? So there are so many healthy habits that can help to lower your blood pressure. So it's very critical to manage your blood pressure and preserve your health for so many years. So prevention is the key right here. But if you're already diagnosed, you have to make sure you pay attention so you can manage them well. So you check your blood pressure regularly, be physically active. There is a video I did on physical activity. I think you should watch that video and get going with your physical activities. You should also manage other medical conditions. So if you have other conditions, you have to make sure that you're following the regimen, manage them really well so that it doesn't impact your blood pressure. Remember, earlier on we spoke about the impact of blood pressure on the different organs of your body. So it's really important for you to manage your blood pressure so that it doesn't impact these different various organs in your body. Keep a healthy weight. Eat healthy diet, like more fruits and vegetable. In another video, I'll talk about DASH diet, those diet that is encouraged for blood pressure management. Limit your salt consumption. These days, people have taken away salt from their table so that when meals are made, that's it. You do not put extra salt, trying to increase your salt intake. That would impact your blood pressure. Limit or abstain from alcohol consumption. Sometimes it's really challenging for people to completely abstain from alcohol consumption, so we say limit. But I tell you now, some research have said even moderate alcohol consumption does impact your blood pressure. I would say abstain from alcohol consumption if you're already diagnosed with blood pressure. Take your med as prescribed at specific times of the day. So, for example, if you take it in the morning at 8 o'clock, between 8 to 9, you should be consistent with those time because that would really help to regulate your blood pressure. Remember to speak to your healthcare provider to make sure that the meds you take, that if you have other medication that you are taking, doesn't affect your blood pressure. Do not self-medicate. Do not self-medicate. I've seen a lot of people who are taking medications for blood pressure or diabetes or one condition, self-medicate. They have other kinds of concoction or mixtures of medications. They go over the counter and pick up drugs. Some of those drugs can interfere with your blood pressure medication. So make sure to check with your doctor or your health practitioner about certain medication. So self-medicate, self-medication is something that you really need to avoid. Keep all your follow-up appointments. Don't say, I feel much better now, and then you cancel your appointment. It's important for you to keep your follow-up appointments and speak to your doctor or your health practitioner about how to manage your blood pressure. But always remember, if you can remember this will be great. Medications alone are not enough to lower your blood pressure. For best result, you need to live a healthy, active lifestyle. Please make sure to share this video and remember to subscribe to my channel. I'll see you on my next video.